On behalf of the co-authors, it's my pleasure to present the results of the ASCENT trial, randomized phase 3 study of sacituzumab govitecan versus chemotherapy of physician's choice for patients with previously treated metastatic triple-negative breast cancer. Metastatic triple-negative breast cancer is associated with poor prognosis, and there's a need for better therapies. Sacituzumab govitecan is a novel TROP2-directed antibody-drug conjugate. It binds to TROP2, has a high drug-to-antibody ratio, and the active payload is SN38. The drug also has a bystander effect. In the ASCENT trial, we investigated sacituzumab govitecan versus treatment of physician's choice for patients with metastatic triple-negative breast cancer who had received at least 2 prior lines of therapy for advanced disease. A total of 529 patients were enrolled in this study. In terms of the results, the study showed a significant improvement in progression-free survival with sacituzumab govitecan versus standard chemotherapy. The median PFS was 5.6 months versus 1.7 months with standard chemotherapy, and this corresponded to a hazard ratio of 0.41 that was statistically significant. Similarly, for overall survival, there was a doubling of overall survival with sacituzumab govitecan versus standard chemotherapy, median overall survival being 12.1 months versus 6.7 months with standard chemotherapy, and this corresponded to a hazard ratio of 0.48 that was statistically significant. The objective response rate was also higher with sacituzumab govitecan, 35%, as compared to 5% with standard chemotherapy. In terms of safety tolerability, the drug was well tolerated. The treatment discontinuation because of AEs was very low, common AEs being neutropenia, diarrhea, as well as anemia. So in conclusion, ASCENT is the first phase 3 study of a TROP2 antibody drug conjugate in pre-treated metastatic triple-negative breast cancer to demonstrate a significant improvement over standard chemotherapy with improvement in median PFS, median overall survival, and objective response rate. The drug was well tolerated with manageable safety profile consistent with previous reports, and this study confirms that sacituzumab govitecan should be considered as a new standard of care for patients with pre-treated metastatic triple-negative breast cancer.